I'm Dr. Catherine Miles, and I'm presenting the kidney model for optimizing feedback in undergraduate clinical communication sessions following a meta-ethnographic review. So clinical communication training sessions for medical students often use experiential teaching methods with consultation role play between a student and a simulated patient. Verbal feedback about observed communication practice is a valuable component of the experiential design of these sessions. Feedback from a tutor, peers, or simulated patient can reinforce effective communication, facilitate correction of mistakes, and highlight omissions to result in a realistic sense of learner competence. Learner reception and application of feedback may result in more effective future communication and ultimately doctor-patient communication that is effective, resulting in increased patient satisfaction and health outcomes. Feedback guidance has focused on transmission of feedback information from a tutor to a learner, but more recently there is recognition of feedback being an interactive and co-constructive event incorporating active learner participation. There is a lack of knowledge of how components of feedback frameworks or models interconnect to form a system to optimize and increase effective feedback reception and application for learners. We conducted a meta-ethnography to identify and synthesize guidance for optimizing feedback interactions in undergraduate clinical communication simulations and to create a comprehensive feedback model for effective feedback receiving. Meta-ethnography is a well-established methodology for qualitative synthesis and was appropriate due to the limited literature available and qualitative studies giving deeper insight into participants' experiences. We used Noblet and Hare's 7-phase interpretive approach, and having chosen the focus of the literature review, phase 1, we proceeded with phase 2 and identified and selected studies searching in electronic databases, including Medline, PsycInfo, Sunel, and ERIC databases, and Gray literature searching. Records were exported to EndNote and deduplicated, and then Rayon software was used for peer screening of abstracts and the decisions about inclusion and exclusion. 45 full texts were assessed for eligibility, resulting in 7 studies for inclusion, and citation studies searching of these and expert referral resulted in a total of 14 records for inclusion in the meta-ethnography analysis. For phase 3, after repeated reading of the studies, data was extracted from each full study, and in phase 4, relationships were determined between studies according to the focus of the study, context, and feedback components. For phase 5, components of feedback were compared for similarities called reciprocal translations, and NVivo software was used for organizing the process. Codes were discussed, expanded, added, or collapsed as needed. Miro mapping software was used to visualize and preserve the relationships between concepts both within and across studies. For phase 6, the reciprocal translations were synthesized, resulting in a new model for feedback, which was expressed in phase 7. The new feedback kidney model illustrates interconnections of various feedback components that allow for effective feedback receiving. The diagram is to be read from top to bottom. On one side, there are the components the tutor can use in the session to help the learner receive feedback, and on the other side, the learner components, and the interconnections between these are illustrated. The dotted arrows indicated the ongoing cyclic process of feedback. The main themes included in the new feedback kidney model are preparation of the environment, culture, and relationships, proactivity of the student to request feedback, analysis and feedback information, reception and response, including management of emotions, and characteristics of the learner. This meta-ethnography provides an up-to-date synthesis of feedback guidance and extends our understanding of feedback components and their use to guide these conversations for medical educators and students, to optimize student feedback reception and application, and for improved future doctor-patient communication. These are the references. Thank you so much.